Welcome back to this installment of What to Expect When You're Expecting.
Today, we will follow 6 couples through their pregnancies to give you a better understanding of what to expect when you're expecting.
Through the first trimester, we will be following Adriana, Marat, Anna, and Graham.
This covers the first 12 weeks of pregnancy, when physical and emotional changes occur as the embryo develops into a fetus and major body organs begin to form. Let's take a look.
Hey guys! Hi! Fancy seeing you here. I know. How was your guys' honeymoon?
It was good. We went to Spain.
Oh my gosh, that's so exciting.
Fantastic.
Well, should we celebrate with a drink?
I would, but I'm not drinking right now.
Oh my gosh, you're not drinking? I'm not drinking either.
Wait,
Are you?
No!
Yes.
You're pregnant!
Yes. And you are.
Stop.
Come in.
Hello, we're here for our appointment.
Yeah, have a seat.
Thanks.
Hi, my name is Dr. Ann, and I'll be your physician throughout your pregnancy. So this is your first checkup. How are you guys doing?
Well, I haven't really felt any symptoms of pregnancy yet, so I was just wondering if that was normal.
How far along are you?
Just 4 weeks.
That's perfectly normal for 4 weeks because at this stage your baby's just developing, so you'll notice that you'll feel the need to urinate more often and you'll have a lot of morning sickness.
So I'm 6 weeks along, and I was just wondering what types of things we can expect during our first trimester.
During your first trimester, you'll expect nausea and vomiting, so be aware of your surroundings. Also, make sure not to work yourself too hard because you'll feel fatigued very easily. And also, you'll also notice yourself having a lot more mood swings, so expect that as well.
Thank you so much. You've been really helpful to us.
Yeah, I've learned a lot from talking to you.
It's no problem. I just have one caution for you guys. Throughout your first trimester, it's very vital that you guys stay healthy and take your vitamins and exercise with not too intensely because it is more likely for you guys to have a miscarriage during this period than during any other period.
Okay, well, we'll be careful.
Sorry, we're late.
Here are the new moms coming out of their doctor's appointment now. Let's ask them a few quick questions.
Hi guys.
Oh, hey.
So Anna, you're at week 4. Have you been experiencing any cramping or spotting as HCG is being released?
Actually, I just took it for my period, but it turns out that is a completely normal thing at week 4 of pregnancy. So I just kind of am hanging in there, and I think I'm good.
Adriana, because you're at week 6, were they able to detect a heartbeat on the ultrasound?
They were, and it was so beautiful, and I just feel so motherly now, and I'm also starting to get some morning sickness.
That morning sickness. Well, thank you for your time.
Thanks,
guys.
Bye.
And now to a commercial break.
How are you?
I'm good. How are you?
Stop! Put that bottle down. Drinking while pregnant affects you and the baby.
Yeah, drinking can cause a lot of birth defects for the baby.
How are birth defects caused by drinking alcohol?
Alcohol consumption causes fetal alcohol syndrome and fetal alcohol effects, such as alcohol-related neurodevelopment disorder and alcohol-related birth defects.
What is fetal alcohol syndrome?
Fetal alcohol syndrome causes a lot of abnormal facial features, growth deficiencies, and central nervous system problems.
Yeah, the facial abnormalities are small head size, narrow eye slits, and abnormalities of the nose and lips.
Wow, thanks. I learned a lot. I want my baby to be as healthy as possible.
Yeah, you're welcome.
Just remember, fetal alcohol syndrome is 100% preventable as long as the mother doesn't drink alcohol while pregnant.
And now, here's AJ and Megan, Riley and Viali. Let's watch as they both enter their second trimester and see what changes their bodies and babies are experiencing.
Hi, Dr. Smith. This is my best friend Riley and her husband Viali, and I'm Megan, and this is my husband AJ.
Well, hello guys. It says right here you're in your 13th week.
Yes, we are entering the 13th week, and we actually plan to get pregnant at the same time.
How fortunate. Do you guys have any questions? Do you maybe wonder what's going on in your body?
Will this nausea go away?
Yes, most women feel nausea and during the beginning of the second trimester.
So what's happening with our babies?
Yeah, how developed are they?
Well, you see, you're both in your 13th week. Your babies will actually be urinating, as well as the bones, limbs, and head becoming more apparent.
Will we be able to know what sex they are yet?
During the 14th week, you should be able to tell via an ultrasound.
So can we come back in a few weeks to check?
Well, sure, it looks like we can get you in 5 weeks.
Actually, we decided that we wanted the sex of our baby to be a surprise.
That's not a problem. You're not required to know. See, 5 weeks from now, your babies will start making sucking motions with their mouth, and his or her movement may become apparent in ultrasound. Right now, it should be 5.5 inches long.
5.5? How's that possible?
The baby grows each week.
He's a little scared if you can't tell.
Well, aren't we all? Having a baby is a beautiful process. Trust me, you're in safe hands.
We'll see you in 5 weeks.
Bye.
Hi, Dr. Smith. It's nice to see you again.
Hi, Riley. Hi, Megan. How are you two feeling?
No nausea.
Me either. So is it time for my ultrasound to see if I'm a boy or a girl?
I'm rooting for a boy.
AJ, you can't pick what we have, and you'll love whatever we have.
Yes, you can do an ultrasound. And good news, you're halfway through your pregnancy.
Oh, really? It only seems like it's been a month.
It goes by fast, doesn't it? By now your babies can swallow, and they also have footprints and fingerprints.
Wow, it's really amazing.
Yes, life is amazing. Megan, how about you go lie down and get ready for your ultrasound?
Okay.
Good. Congratulations, Megan. It looks like you're going to be parents of a baby girl.
So, can she hear us yet?
Struggling. Actually, yes, she began to respond to your voices. She can also have fingernails now, so you better get the nail polish ready.
Are we really having a girl?
Yes, I'm so happy.
Congratulations, guys.
Hey, if it turns out we have a girl too, then they can be best friends.
Of course.
Alright, so it looks like the second trimester has come to an end. Your baby should be growing very rapidly.
What's gonna happen now?
Well, as of now, your babies have their lungs and nervous system developed.
Wow, really?
Yeah.
So basically all that's left to do now is just grow?
Most of the development is complete. Your baby should weigh around 2 pounds already.
That's funny, because I gained like 20.
That's normal. Just keep a balanced diet. And moderate exercise like walking will also help. Keep taking your vitamins.
Thank you, doctor. Thank you.
Wow, what a magical experience this truly is. Now for a commercial break.
Welcome back as we delve into this eventful third trimester, where many changes occur and the body prepares itself for birth.
Liz, Jeremy, Julia, and Rashab are experiencing this process firsthand. But first, let's take a look at their epidural and birthing options. While visiting your prenatal healthcare provider, there are many questions you will have.
While planning your birth process, there is one important question that you must not forget.
Ask about pain medication during childbirth, including risks, benefits, and side effects.
We must remember that birth can't always go as planned, so it's best to know all your options.
Most women prefer an epidural, which completely eliminates all pain in the lower half of your body.
It's true, the injection into your spinal membrane may be unpleasant at first, but it'll make you a lot more comfortable during birth. However, epidurals may lower your blood pressure dramatically, and so it'll make labor more difficult.
Something very similar is a spinal block, only it doesn't last as long. An epidural is given at the beginning of birth, while a spinal block is given after many hard hours of labor and a woman decides she can't deal with the pain anymore.
Other women prefer narcotics to simply dull the pain. While narcotics can help with anxiety and the pain during labor and contractions, they can have lasting effects on you and your baby.
No matter what you plan on, expect changes. Women experience birth differently, but in the moment, do what's best for you and don't second guess your choice.
Talk to your prenatal doctor today or call our nurse hotline at 444-BABY.
Well, hello there, and welcome to Lamaze with Mary Lois and Carol.
Today we'll be discussing some birthing options for you and your loved one.
There are 3 main birthing options. These are the traditional birth, the water birth, and the C-section.
During a traditional birth, the baby's head will be facing the cervix. It will then travel down the vaginal canal as you mommies push.
It is common for your first birthing process to take a longer time than your following ones. This may take many hours, but it will be worth it when you and your loved one are home with your beautiful baby.
The next option is the water birth. Now this is a great option if you mommies want to give birth in the comfort of your own home. Feel free to move around and allow the water to caress your changing bodies.
If you mommies are worried about your babies being in the water, remember, it has been living in the amniotic fluid inside of you for the past 9 months. Also, your baby is still connected to you mommies through the umbilical cord, so your precious bundle will continue receiving oxygen until the cord is cut.
Now, the water birth is a major decision, but if you choose the water birth, after the procedure, you and your loved one will be at home to enjoy some time with your beautiful bundle of joy.
Our next option is the C-section. This is usually utilized during an emergency situation when the baby is breached, which means its bottom is facing the cervix, when it is in a transverse position, which means it's sideways, when you have placenta previa, which means your placenta is so low it's covering your cervix, or when your baby has macrosomia, which means it's simply too big.
Now, in an emergency situation, the C-section will take a quick 2 minutes, but in a non-life-threatening one, it'll take anywhere from 15 to 45 minutes. The doctor will inject you with an epidural, which will numb you from the waist down. He will then make a tiny incision in your tummy to get to that uterus, and he'll pull that baby out.
If you mommies are worried about the scarring, asking your doctor for a transverse cesarean will ensure more conspicuous scars.
Now, the C-section can be a very serious procedure, but thanks to modern medicine, the procedure will be over in no time, and you'll be at home with your beautiful bundle of joy and your loved ones.
Thank you for joining us on Lamaze, and we hope you join us in one of our local classes soon to discuss the birthing positions.
Signing out, this is Mary Lois.
And I'm Carol.
Now have an amazing time at home with your beautiful bundle of joy and your loved one.
Now that these couples have this vital information, they will be able to evaluate and make informative decisions about which options are best for them.
Hey Liz, remember we have a doctor's appointment at 3 o'clock today?
Oh yeah, I know. I had to ask her about being warm all the time. My swollen ankles and feet.
Alright, we'll do that when we get there.
Can't believe I'm already in my 28th week of pregnancy.
So how are you guys today? How are you feeling, Liz?
I'm kind of anxious and a little clumsy, and I've had some difficulty sleeping.
Well, don't worry. Those are normal signs. And your glucose screening test came back with low numbers, so you're on the right track for your insulin production. Have you been eating your vegetables? Don't forget to take your iron supplements and drink your milk too. Your baby can taste the flavors during this trimester, so they'll have a better chance for a healthy diet in the future.
Oh, don't worry, I'll keep an eye on her. There's one thing I've been hearing is there's been a lot of premature births. What can we do to make sure our baby's born on time and not early?
Well, as you already know, you need to stay away from smoking and alcohol use, and we will continue to monitor your blood pressure. So let's check right now. See? Yeah, your pressure is a little high, but that's completely normal for this stage in pregnancy.
Okay, great. Is it normal to have this much swelling in my feet?
Let's see. Yes, as long as it isn't accompanied by headaches and changes in vision, which is called preeclampsia.
Liz also mentioned that her I don't know how to be.
The
frank.
twitching?
Yes, her was twitching.
Yeah. Well, Jeremy, that would be your baby hiccuping.
Oh. Yeah, I felt her kicking more too.
Okay, well, you seem good for today. I'll see you in a few weeks.
Okay.
We should start talking about the birthing and pain techniques. Those Lamaze classes we took are actually really helpful, but, I'm still not sure.
Yeah, I know what you mean. I think I want to go with the epidural block. There's also tranquilizers that help calm me and relax me if I get too anxious. Plus, there's also electrical nerve stimulation that stimulates nerve pathways to the uterus and cervix. I'll ask some of my friends what they decided. Okay, thanks.
Well, welcome back. Congrats on your 8th month. We're in the home stretch, guys. You've probably been feeling heartache, increased constipation, and backache, but that's totally normal. Today we have to take your weight, listen to your fetal heartbeat, and take a swab sample, and you'll be on your way out.
I feel so fat and bloated. I've gained so much weight.
No, you're perfect. I mean, you're carrying life inside of you. You can't really complain.
Oh, you guys are so precious. Well, okay then. It's normal to gain 1 pound a week during this stage, so let's go ahead and check. Alright, let's take a look here. Yep, right on schedule. Now you can sit back down and we'll listen to the heartbeat and then discuss your swab sample.
What does the swab sample do?
Well, this checks for group B strep, which is a bacterium that can be found in the vaginas of healthy women. You tested negative, which means both you and the baby will be safe during childbirth.
I've been hearing some shortness of breath and less movement, but sometimes it's a lot more painful. Is that okay?
Yeah, changes in the respiratory system is common during pregnancy. Also, the baby is bigger now, so it doesn't have much room to move around. But you guys are all clear to go now. Thanks for stopping in.
Thank you.
So you said on the phone that you've been having a lot of relief over these last few weeks. My guess is that you're experiencing the lightning, which is when your baby drops into the pelvis. Most women associate this with breathing becoming easier.
Oh yeah, it's been a lot easier to breathe now, but I have been feeling a couple of twinges down there, if you know what I mean.
Do you feel ready to give birth soon?
I don't think I am.
Oh, I am ready to pop this sucker out, yeah. As
more-
soon as possible.
Well, no more A-cups, honey.
Oh yeah, Rashab here loves the big boobs, but there is some discharge coming out.
Oh
It's
yeah,
a little
that's
nasty.
That's normal in the 3rd trimester. It prepares for nursing, lactation.
Oh.
But good news, looks like your baby is lying in the vertex position with its head first.
Yeah.
This is the best position for birthing. So get excited, folks. The end is near. Just make sure you call us if you experience any contractions or if your water breaks.
Oh, will do. Thanks, doctor.
I'll go bring the car around the front, honey.
All right. Hi, Karen. Yeah, it's me. Yeah, it's Julia. We just got out of her appointment now. Oh, yeah. My stomach's been killing me, really. If I didn't know any better, I think I was having a contraction. I don't know. Ugh. Yeah. It's been rough. I'm a little out of breath lately. Oh, yeah. Oh, I don't know. What do you think I should do? Rashab's just been so annoying. Yeah. He really needs to get a hold of himself before we have this baby. Ah! Oh my gosh! My water just broke! Karen, I need help! Karen! Help, somebody! Help!
Did I miss anything?
Yeah, I'm just giving birth here. My water broke!
I guess we left.
Right? Do I look all right? Oh, my water broke. I'm having a baby.
I guess we'll have to go to the doctor now.
We're already here. Help me.
8 hours later.
Okay, Julia, just breathe deeply and calmly.
Doctor, my back hurts.
It's okay. Looks like you're about 7 centimeters dilated. We can give you the epidural now if you'd like.
Yeah, I want that. Yeah. Oh, yeah.
It's like, stop. Then we'll stop it there.
Oh, get this thing out of me!
Try and calm down. It's okay, sweetie.
Shut up! This is your fault! You did this to me! It hurts!
Alright. Okay, the cervix is thinking it's time to start pushing. Okay, the baby's crowning. Keep pushing. I see the head and the shoulders. It's out. Would you like to cut the umbilical cord?
Sure.
Here's your child. That's the most beautiful thing I've ever seen. It's ours. Don't hit him so hard. Oh, I need to tell Karen about this. I'm so glad this is over.
Well, not yet. We still need to birth the placenta, so just get ready to push one more time.
Oh, take the baby. Oh. 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 Our little bundle of joy.
This baby's so cute.
Now that we've covered the whole process of pregnancy, we hope to leave you more informed about the changes going on in your body during this time.
Tune in to our next installment to learn about the newborn baby. Thanks for watching.